Hi everyone, welcome to the latest medical educational video by Dr. Wellness. My name is Dr. Chen Yiming. I'm a medical doctor in Singapore and founder of Fitivate.com. It is our health and wellness platform. Please access it and enjoy the contents there free of charge. Please click the subscribe button and turn on the notification so that you will know whenever we upload a new video. The subscription matters and it is what keeps us motivated and going to produce more educational and valuable videos. So let's move on to the topic today. Today we're going to be talking about hypertension, right? Let us learn more about what hypertension is, what are the symptoms of hypertension, the complications of hypertension, how we can manage it, how we can treat it with or without medications. Hypertension is a very common medical condition in Singapore. It's been estimated that about 25% of our adults aged between 40 and 69 has hypertension. It is a silent killer, and today we're going to share more about the myths of hypertension and what you should look out for and what are the best practices. Wrong! Hypertension is known as the silent killer. Most of the time, there are no symptoms. Hypertension is usually diagnosed during opportunistic health screening or when you are seeing your doctor for other reasons. It is highly recommended that patients aged 40 and above should get an annual health checks done. Get it diagnosed and get it treated to prevent serious complications in the future. Uncontrolled hypertension is a big deal. When you leave hypertension untreated, the long-term complications may include stroke, ischemic heart disease, heart failure, kidney failures leading to renal dialysis. For every increase in 20 mm mercury of blood pressure in a patient aged 40 to 69, it is associated with a doubling of the mortality rate. Hypertension is a big deal and you should be treated straight away. No, I disagree with that statement. Medication is not the only treatment for hypertension. In fact, the first-line treatment for hypertension is actually lifestyle changes. So what are the lifestyle changes that we can do? 1. Diet. We have to carefully watch what we eat. Reduce in sodium intake or salt intake. Reduce in sugar intake. Reduce in fat intake. Always go for fresh food instead of processed food. More fruits and vegetables. Okay? So the famous quote, "An apple a day keeps the doctor away." That is really true. Second, our lifestyle. Stop smoking. A lot of chemicals in the cigarette smoke actually causes hardening of the arteries, constriction of the arteries, blocked arteries, and that will lead to hypertension and many serious cardiac complications in the future. Limit your alcohol intake. Okay? We try to limit alcohol intake to 2 units per day. Okay? A unit being a shot of hard liquor, a can of beer, or a glass of wine. 3. Exercise. Health Promotion Board Singapore recommends 150 minutes of exercise a week. Don't ask me which exercise is the best. As long as you're exercising, it works. In fact, it's been shown that exercise reduces the blood pressure by about 5 to 10 mm mercury without medications. 4. Sleep early. Sleeping is an undervalued component of our life. When you sleep better, you feel better, your blood pressure gets better. 5. Manage your stress. We're living in a very stressful lifestyle, in Singapore particularly. Stress is bad for our health and stress causes hypertension. Learn to manage that and your blood pressure will improve. Lastly, watch our weight. And if you are obese and overweight, I think it is a good thing to actively reduce the weight through our diet and exercising. And by reducing the weight, we effectively lowers the blood pressure. Wrong again. I have to disagree with that. Taking of blood pressure medication is not always lifelong. I have a lot of patients which, when religiously going through lifestyle changes, they could actually bring down their blood pressure, and we were able to take the medication off, okay, without them actually having elevated blood pressure. This has happened before, and it is very encouraging, and I urge all of you to adopt a healthy lifestyle so that you can treat hypertension without medication. So previously I've mentioned that diet is an important step in preventing hypertension and treating hypertension. So let us talk a bit more in details about eating our way out of hypertension. Number one, be careful with the ingredients that you use during cooking. Avoid salt, avoid gravy, avoid sauce. Okay? Help to spice up your food by using herbs and spices. Onion, garlic, chili padi, spring onion, etc. We should also avoid food that is high in sodium, okay, like ikan bilis, preserved fish, preserved vegetables, ham, sausages. When you're eating out, remember, cut down on the portion, cut down on the sauce, cut down on the gravy again, okay? Avoid drinking the soup out, because the soup that they cook is often loaded with large amount of salt and MSG. 3. Grocery shopping. Make sure you buy into colors and you buy fresh. What do I mean? Go for fruits and vegetables that are very colorful. Okay? Your green leafy vegetables, your tomatoes, your carrots, your onions, your peppers of varying colors. Okay? Buy fresh. Always go for fresh produce, fresh fish, fresh chicken, fresh meat, and avoid processed food because those are also very bad for your hypertension. Lastly, be careful of what you drink. Many people forget that what you drink contains a lot of contents, a lot of minerals, a lot of sugar, and a lot of salt. Right? Please, if possible, always go for plain water. Avoid very heavily flavored drinks. Avoid colored drinks because invariably colored drinks and flavored drinks are often loaded with sugar and with salt sometimes. For example, like your sports drinks. So that's it. We've come to the end of our video. Okay? Please, again, I stress, help to click on the subscribe button and turn on the notification to allow us to let you know when there's a new video that we have produced. I truly hope that you enjoyed the video today and I hope you learned something from it. Okay? Till the next time, I'll see you again.